So today what we're going to do is we're going to break down baby step number 2, which is obviously the second step in our baby steps to pain relief. Now, baby step number 2 is what we call practice first aid. So I'm going to say practice first aid. We're going to talk a little bit about why this is important, okay? So what we want to know is first aid, right? It sounds exactly what it sounds like. What you want to do is take your pain or your injury that you're dealing with and you want to slow it down, okay? You want to make it better. You want to go from an 8 to a 7 to a 6 to a 5 to a 0, right? You don't want to stay in pain. You don't want to have low level pain. You want to get rid of it. And when you're going through inflammation, when you're going through some pain, when you're going through some discomfort, the number one goal is to get out of pain. And most people, what they do is they try to strengthen too fast, too soon. And, I'm guilty of it as well. Physical therapists, chiropractors, many other people are too guilty from jumping from pain relief all the way to get you out of pain and into some sort of strengthening program. And that is a big mistake. So what you want to do is practice any movements that actually help you. What is something that helps move the pain down? So we want to focus on decreased pain, okay? What are the movements or positions that constantly decrease your pain, right? Is there a certain exercise? Is there a certain stretch? Is there a certain therapy? This is also where we're okay with what we call passive modalities, okay? Things like ice or heat or chiropractic or stretching or somebody having a TENS unit placed on you. These is okay at this point in time. What we want to do, again, is anything that we can do that reduces our movement. Is it walking? Is it hiking? What is it? Because we do not want to create more pain, more inflammation, and more irritation. If you think about it, if there's a nerve, if there's a muscle, if there's something that's strained out, what you normally do if you roll your ankle is you ice it and you rest it, you compress it, you add a little bit of gentle movement, but you don't trigger those issues and you just try to reduce them the best you can. Now, you also want to ask yourself when you're doing these movements or stretches or exercises, do they create lasting relief, right? Maybe how long do they last for, right? So you're going to say how long, right? How long do they last for? Are they short-term? I'm going to say ST, short-term, or long-term relief. Is it 5 minutes or is it 5 hours of relief? What are you getting out of first aid, right? So again, the baby step number 2 is to practice first aid, reduce your pain, and do any sort of movement that absolutely helps you. And once you find out that movement and you're sure of this movement, you have to be sure of it. That's why we're talking about short-term and long-term. Once you're sure of it, do more of that reduces your pain. So if you want to find more out about the baby steps, keep watching some of these videos. There's a few of them up there, and I'm going to go through every single baby step by step, and questions you should ask yourself to help get out of pain.